And people are, well, you're going to want to see me that often on a regular basis. The answer is no. I don't know. It depends on how your physiological limitations respond to the training. You know, if you've had this issue for 5 or 6 years, then yeah, I'm going to continue testing you to be able to determine that we're continuing to make the changes that I expect at a physiological level. But you know, generally I'll go out 3 months to 6 months after that. So it's really important not to think of this as getting one test done. It's your checkup to find out where everything should be changing. Now, what you don't want is go back to somebody else who just handed you a report and do another test so you can see your VO2 max change. That's not the point. Of course, it's going to change. You know, especially if you have a low VO2, you basically don't have to do too much to be able to make it go up. Just to be a little more active. Doesn't mean that you know what changed. Just that number changed, but what system changed, if any. So I think you know, when you're talking about a pro level athlete where the VO2 is at the top and they're not likely to change, we need to refocus them and be able to say, well, you know, you have really low METs, or you can't run a good speed at that, or you can't turn a good wattage at that. Then we are allowed to be able to change and refocus their training program to be able to get them to maximize their results.